What are fibroids and how do they affect fertility and pregnancy? Fibroids are benign or non-cancerous tumors that can be found on or inside the uterus. Fibroids are fairly common and about 20% of women in the reproductive age group will have fibroids. Fibroids vary in size, which means they can be as tiny as a seed or as large as a melon. They also vary by location, with some fibroids being inside the uterine cavity. They can be found in the wall of the uterus or on the surface of the uterus. While smaller fibroids may show no symptoms at all, larger fibroids can present with symptoms such as heavy or painful menstrual bleeding, pain during sexual intercourse, pain or a feeling of fullness in your lower belly, lower back pain, constipation, inability to empty the bladder completely, difficulty getting pregnant, or recurrent pregnancy loss. While many fibroids don't require any treatment, fibroids that are large or cause severe symptoms can be treated with medications or surgery. So how do fibroids affect fertility? About 5 to 10% of women experiencing infertility will have fibroids. This doesn't mean that all women with fibroids will have trouble conceiving. Whether or not fibroids affect fertility will depend on their size and location. Some ways in which fibroids can affect fertility are that they can change the shape of the cervix, which can make it more difficult for the sperm to swim up and reach the egg. They can change the shape of the uterine cavity, which can affect the movement of the sperm and the embryo. They can block the fallopian tubes and prevent fertilization, that is the meeting of the egg and the sperm. And they can affect the blood flow to the uterine cavity, which prevents the embryo from attaching to the wall of the uterus. Women with fibroids that get pregnant are at an increased risk for miscarriages or preterm labor. Some larger fibroids can also change the position of the baby inside the uterus and increase the risk for a cesarean section. After examining you, your doctor can make the right decision for managing fibroids in your particular case and situation.